Hello, my name is Allison Werner. I'm the Chief Editor of Orthodontic Products. Thank you for joining us for today's episode of In the Sterilization Room with Jackie, where we talk to infection prevention expert Jackie Dorst about what you need to know to keep you, your staff, and your patients safe during the COVID-19 pandemic and beyond. For over 20 years, Jackie has been a consultant specializing in instrument sterilization and infection control and prevention in the dental setting. She has degrees in microbiology and dental hygiene, and she has been a featured speaker at the American Dental Association and the American Association of Orthodontists. Jackie, it's nice to see you again this week.
Hi, Allison. Yes, this is our 20th episode of In the Sterilization Room. And, right now we've been focusing on remodeling that dinosaur of a sterilization room and updating it for some offices that are looking, how do we get to the standard of care for sterilization in our orthodontic practices? So I think we're on step 3 of the 4 steps today.
Yep, exactly. And so like in our first episode, we kind of did a 4-part of just the whole overall view of, what the remodel or kind of the considerations that need to go into it. And last week we really focused in on instruments and cassettes and figure out getting that lean orthodontic procedure kit together. So this week I know we're going to talk about cleaning and sterilizing. So, and the equipment that go into that. So I think this can be really valuable for our listeners.
Yes. Now, so last week we decided, which size cassette the orthodontic was going to use, what were the different cassettes available to them. And once they've determined that, then they can even calculate the number of instruments that they're going to need to go into those cassettes based on the number of patients that they see every day. And it was important to know that size first, because now we have to know how many of those cassettes can we get into each load of the ultrasonic. If you're using an ultrasonic to clean instruments, how many of those cassettes can we get in each load of the sterilizer? And that in turn is going to determine how many sterilizers the doctor needs to purchase. So let's look at the cleaning equipment first. That's the next step. The dirty cassettes come into the room, and then the doctors have a choice of 2 different methods of cleaning instruments, staying with the traditional ultrasonic method or using the new method of instrument washers.
Okay.
Now, ultrasonics are, it's like a liquid bath containing hopefully an enzymatic cleaning solution that's designed for an ultrasonic. Ultrasonics clean the instruments by cavitation, meaning that the bubbles implode and it pulls the debris off of the instruments, getting into the real small areas in between the hinge on the pliers and the knurling on the handles. Ultrasonics get instruments 17 times cleaner than you could ever get those instruments hand scrubbing them.
Oh, okay.
Although there's some things that need to be done to protect instruments from corrosion. Water and metal, like even stainless steel, there's a potential for rusting and corrosion if you don't protect the metals during that cleaning and sterilization process. So with ultrasonics, after they're cleaned, then cassettes or even loose instruments have to be taken out, and that solution has to be rinsed off of them. So you rinse them underwater to get, and there can even be debris in that ultrasonic solution that came off of the pliers. So you definitely want to rinse them. It's similar to washing dishes in the kitchen. You want to rinse your dishes after you wash them.
Right.
Then after they're rinsed, there has to be one additional step of protection added to those instruments, and that is using what is referred to as barrier milk or surgical milk. It's a final rinse for the instruments that provides a chemical that is both a lubricant and an anti-corrosive coating on those instruments to protect them during the steam sterilization, which is going to expose them to another layer of water, if you will, during that sterilization process. Now, we've discussed in previous episodes the big advantage of going to steam sterilization over the old dry heat sterilization. Number one, we can package instruments in steam sterilization because of the configuration, both of the interior of the chamber and the wrap, the paper wrap that you use to wrap cassettes or the peel view pouches. You can package in dry heat, but it's an expensive high temperature nightclave that has to be used because of the high temperature. Dry heat will go up to like 375 degrees Fahrenheit. Autoclaves will sterilize at 250 to 273 degrees Fahrenheit, so
Okay.
100 degrees cooler.
Mhm.
And that allows you to sterilize plastics, hand pieces, and all of the other items in the one load in the autoclave that you couldn't sterilize in dry heat. So big advantage there.
Mhm.
So again, we've got to protect those instruments after they come out of the ultrasonic cleaning. We're going to do that rinse with surgical milk or barrier milk. It's an expensive chemical, so they're going to buy a quart or a gallon of it. I've seen quotes on that chemical for like $50 a gallon.
Oh, okay.
Now, fortunately, you can use and reuse it for 1 week because you're putting clean instruments in it. It's that final rinse
Oh,
with
okay.
it.
Okay.
And you dilute it more really than is recommended, because if you mix it at that strong solution or strong concentration, then you can get an extra oily buildup maybe on the pliers.
Oh,
So
okay.
I like for them to dilute it a little bit more. So that final rinse, then you still have wet instruments, so you take them out, drain them, and then
Mhm.
those cassettes and individual pliers have to dry before packaging.
Okay.
That's recommended by CDC. It's part of the SD 79
Mhm.
AMI recommendations on medical dental sterilization. Dry the instruments before you put them in pouches or before you wrap the cassette. The
Mhm.
reason for that is that steam in the sterilizer needs to touch the surface of the instrument to achieve sterilization.
Mhm.
Anything that prevents the steam from touching the surface of the instrument, such as a drop of water, could interfere with the sterilization process. The
Oh,
other part is if those instruments are drippy wet, it wets the packaging, and the packaging may tear or poke a hole in it as it's going in and out of the sterilizer.
okay.
The third reason for it is it adds excess water to each cycle of the autoclave.
Mhm.
And that excess water can overcome the drying capabilities of the sterilizer. So like maybe a gravity sterilizer is autoclave is set for 20 minutes drying time. And
Mhm.
when it says done, the instruments are still wet. The packages are still wet when they come out because we put them in wet and added all of that extra water with it. Well, you can imagine if you have metal instruments laying in a metal cassette in a wet wrapper and you put them in a cabinet or in a drawer,
Mhm.
it's going to contribute to corrosion, correct?
Right.
Yeah.
Right.
So you've got to get those dry. So ultrasonic, you ultrasonically clean them,
Mhm.
rinse the instruments with water, surgical milk rinse, then drain and dry, and then they're ready to package. Now, the second method, the other method of cleaning instruments, is the latest technology, and it's an instrument washer.
Okay.
Those instrument washers, it looks like a dishwasher, but it's
Mhm.
not. It's a medical device. It has extremely hot water, a disinfecting type of cleaning solution with it, and extremely high water pressure. So when
Mhm.
those cassettes go into the instrument washer, they are thoroughly cleaned and rinsed in a much shorter cycle time than it is with the ultrasonic cleaning process, because one of the big advantages is at the end of that cleaning process, those cassettes and loose instruments are dry.
Oh,
They're
okay.
immediately ready to package. There
Mhm.
isn't any water left on this. Just like when you take warm dishes out of your dishwasher at home,
Yeah.
they're dry, right? And if they're
Yeah.
not dry, something's wrong with the dishwasher.
Right. Yeah.
Yeah, that's a big advantage to them. And when studies have been done on the effectiveness of instrument washers versus ultrasonic cleaning, it was found that instrument washers get instruments even cleaner
Mhm.
than an ultrasonic does. So big
Oh,
advantage with it. Now, both methods, whether you're ultrasonic cleaning or instrument washing, you have to have good quality water. If your water is really hard in your area, the minerals that are in that hard water are going to interfere with the cleaning process, leave residual minerals on, and you can have water spots. So
oh.
with ultrasonics, like in some areas in the Southwest and along coastal areas, they
Mhm.
actually have to have distilled water that they
Oh,
put into their not tap water.
okay.
And very often with the instrument washers, they will need filtered water or water filtration systems such as the VistaPure to
Mhm.
provide, because they automatically fill and empty. They're going to use whatever water is supplied to them with the water line. So
Oh,
now we've got the instruments all cleaned. They're ready for the next step.
Okay, so where does that take us?
Well, once the instruments are clean, the cassettes are going to be wrapped in that blue paper and
Mhm,
sealed with autoclave tape. Put an indicator on the inside of the cassette. Any
mhm.
individual pliers, like if you put a bird beak and a three-prong together, you may put those into a pouch. And then you seal the pouch on the perforated line. And then
Mhm.
once those instruments are packaged, now we're ready to put them into the sterilizer, the
Okay.
next piece of equipment, the next step of the process.
Okay. So a lot of what we're talking about is getting rid of the dinosaur dry heat sterilizers. So what are those options for the sterilizers if a practice wants the latest technology?
Well, we've been talking about steam sterilization and autoclaves, and they're
Yeah.
basically three different categories of autoclaves. The traditional older type that's been around for decades
Mhm.
is the gravity sterilizer. And
Okay.
what happens is the door closes, water comes into the chamber, it's heated up to create steam, just as you do with boiling water, and then a valve closes and the steam is created and the pressure builds up inside to about 18 to 21 pounds per square inch.
Mhm.
And that pressure pushes the steam throughout the chamber, inside the cassettes, maybe even inside the head of a high-speed handpiece, so that it
Mhm.
can get into that small orifice item, as CDC refers to it. So you want to push that steam throughout the chamber to make certain the steam touches all surfaces of the instruments, the handpieces, every item that is in the sterilizer. Then with the gravity sterilizer, once the cycle is achieved, that sterilization and the steam, then the pressure is reduced, it's released through the valve, and very often the door pops open. The
Okay.
steam may come out. Sometimes they even give a warning, beep, beep, beep. The door is going to open. Don't stand close because you could
Mhm.
get burned by the steam
Mhm.
with it. The
Okay.
steam comes out, and then the hot chamber dries the instruments. So with the gravity sterilizers, the problem is that they don't dry efficiently. And if you take the wet packages out of the sterilizer before they're dry, the pores are still open and there's the potential for what is referred to as wicking through of microorganisms to
Mhm.
recontaminate the instruments inside. That's why the guidelines state packages must remain inside the sterilizer until dry.
Okay.
So gravity sterilizers have been a compromise. Some offices have to leave their instruments in there for like an hour and 15 minutes
Oh,
for them to actually get dry. So that really increases the cycle time.
yeah.
Now, the second type of autoclave is what is called a pulse autoclave. And that's commonly one of the first types approved by the Food and Drug Administration was the a statum. And many
Oh,
offices have a statum because it was a fast cycle through. It was a small cassette chamber. The pressure could build up quickly in that small chamber. And you could even do an immediate use or flash sterilization in less than 15 minutes for items that you needed to turn around quickly, such as a high-speed handpiece.
oh, okay.
However, they don't dry real well either.
Oh.
If you're going to go through the drying cycle, then it can often require 45 minutes to an hour for a full cycle time. And you
Oh.
have to stand the packages on edge, take certain precautions with them to achieve that dry sterilization. The latest technology in autoclaves, in steam sterilization, is what is referred to as dynamic air removal, meaning that it has a pump that it can remove the air at the beginning of the cycle. So it takes out the air and then uses that same pump to pull the steam into the chamber. So rather than being passive, it's now active.
Mm.
And then once the steam is inside the chamber, it really only takes 3 minutes for the steam to touch the instruments to achieve sterilization. So that same pump is able to remove the steam, speed
Mhm.
up the process, and pull in dry air through a sterile HEPA filter.
Oh, okay.
Dynamic air removal sterilizers can greatly decrease as much as 40% the amount of time that it takes for an autoclave sterilization cycle. But we've had a lot of problems historically in the 10 years that FDA has been giving approval to these devices
Mhm.
with the pump. The pumps have failed, issues with the diaphragms on them, all sorts of problems. But one of the latest technologies uses a Venturi system, which is a modified system over having that pump with it, and that's the Statclave. and it reduces that 1 hour autoclave sterilization time down to 38 minutes.
Oh,
And
that's a different.
and the door will not open until the
Mm,
cycle is complete and the packages are completely dry. When you
okay.
take the packages, the pouches or the cassettes out, they're almost crinkly dry, like when you crinkle a piece of paper.
Mhm.
So huge advantage, no chance of wicking through of microorganisms. And
Right.
once those instruments cool, then they're ready to go into sterile storage.
Okay. You talked a little bit about this with the ultrasonic cleaning or the cleaning stage, but is there any risk of corrosion or rusting with pliers at this stage in the process with these machines?
There is, and with that autoclave, especially with the gravity sterilizers, if
Mhm.
those packages come out moist and then they go to the next step, which is sterile storage in, as CDC recommends, inside of a cabinet or inside of drawers. Well, you can
Mhm.
imagine, Allison, if you put a wet package in a drawer, close the drawer, say a handpiece is in there, and maybe that's Thursday afternoon, and you don't come back to the ortho office until Monday morning, that
Mm.
damp or wet package stays in that drawer for 3 to 4 days.
Okay.
Ideal conditions for rusting to start.
Yeah.
So it's critical to have dry instruments before they go into the sterilizers and
Mhm.
dry instruments as they come out of the autoclaves. And I think that's where a lot of orthodontic offices have experienced corrosion of their instruments or their pliers when they've
Mhm.
tried to change from dry heat to autoclave sterilization. Now, the other consideration in this is for the doctor to purchase quality instruments.
Oh, okay.
If the office, has been seeing patients for 20 years, they probably
Mhm.
have some 20-year-old pliers there.
Mhm.
And older pliers may have been chrome plated. They could have brass flanges in them. They were not made of surgical stainless steel that
Oh.
would ensure the quality to get through the rigors of being exposed to steam sterilization. So you do need to look at those quality pliers. However, offices that provide that extra protection of the barrier milk or surgical milk rinse when they're using ultrasonics,
Mhm.
or using an instrument washer that provides dry instruments ready to package, and then they're taking those instruments out and making certain that each package is dry before they put them into sterile storage,
Mhm.
then they'll maintain the quality of their pliers. But you
Okay.
do have to invest in quality pliers from the get-go. You can't
Okay.
use lesser quality pliers. If you happen to buy some inexpensive pliers online
Mhm.
from, let's say a non-US approved source,
Right.
then they're probably going to corrode or rust.
Okay. Okay. That's a good consideration to make. Yeah. Okay. So after those sterilized packages come out of the sterilizer, where are orthodontic practices usually storing them, or where should they be storing them?
Well, I see a couple of different formats for them to store them.
Mhm.
Usually, ideally, I like to have a cabinet with doors on it because it must be an enclosed space. They don't want to
Okay.
just set them out on the countertop or put them on an open shelf. And
Okay.
that it's good if that door has a view door, a window that you
Mm.
can see inside. Because then that way the assistants, they look at the busy afternoon patient schedule and they go, oh my gosh, we have 40 patients coming in this afternoon and we're doing 2 bondings and a debond. Do we have the procedure kits ready for that busy patient schedule? Well, if they can see through those view doors, they can see how many basic cassettes do we have, how many debonds, how many bonding cassettes, or trays. And I like for them to color code the trays. So having
Mm.
that closed in cabinet door, and again, that's where it's critical to have those dry instruments go into that enclosed cabinet. Then if we can have drawers underneath that view door, and that, excuse me, that upper cabinet could also be a pass-through from the sterilization area into the clinical area, so that as the assistants need to retrieve another instrument, they don't even have to go into the sterilization room. That helps
Mhm.
prevent bottlenecks. And it's a visual reassurance to patients. As they're walking through the clinic, they look at that view door and they see all of those sterile packaged instruments. Then even if that patient coming in is a dental hygienist at your best referring practice or a
Mhm.
nurse at a local hospital, they can see all of those sterile instrument packages and reassures them how clean and safe everything is in the orthodontic office. I do see a few orthodontic offices that maybe will stay, if they have the smaller cassettes, they may
Mhm.
store 1 or 2 of them in the drawer of the delivery unit.
Oh, okay.
That doesn't happen as often because the more you scatter out storage, the greater number of cassettes you have to have. If
Oh,
we have central storage, central sterile storage, then it reduces the volume of cassettes and instruments that you need. However, I always recommend that at least one drawer have some sterile pouches of the occasionally used instrument. We talked about, if you're doing a reposition of a bracket.
oh, right, yes.
I may need a bracket holder to actually hold, or maybe a bracket removing plier. So I may put a bracket removing plier and a bracket holder in one pouch. I've got that available. Extra mirror, just have a sterile, because that's the most frequently dropped instrument. If I drop it, it sure is nice to be able to reach in my drawer and retrieve another sterile one and replace that with it. So a bird beak, a 3-prong, if the doctor likes to bend arch wire periodically, that's good for, the doctor says, ooh, I needed a 3-prong. Can you get that? For the assistant to be able to immediately retrieve that and not have to make a trip into the sterilization room, remove their gloves. So I do like to keep. So they can do central storage, central sterile storage in the upper cabinets, in the drawers in the sterilization room, and then have selective additional instruments in one of the drawers of their units.
Okay. Well, so that's storage. Are there any now, we're talking about remodeling the sterilization room overall here.
Yeah.
Are there any guidelines on sterilization room cabinet design or layout for the space?
Well, obviously, we've talked about, the ultrasonic or instrument washer and the sterilizers, depending, the cabinets need to accommodate that number of equipment. If it's an office seeing, say, 80 patients a day, they're going to have 2 sterilizers. I like to have those tabletop sterilizers sitting on the countertop rather than being stacked one on the other, because if it's higher up, those instruments are hot when they come in. A petite staff member might have difficulty with that hot tray of instruments, or a tall staff member bending over to get instruments out of the lower ones. So you've got to have enough countertop space to stack them. And the prime concern, the prime rule, if you will, for sterilization cabinets is that they must flow in the correct flow to provide for efficiency and prevent cross-contamination. That flow is from dirty to clean to sterile. So the flow has to be that on one side of the room, whether it's a long countertop, L-shaped room, or U-shaped room, one side is where the dirty instruments come in. That's where you throw away your trash and put your sharps container, and then the next is the cleaning equipment, and that's all located right next to the sink. If you're using ultrasonics, then the ultrasonic is located on where the dirty side, or where the trash and the sharps container is of the sink. If you're using an instrument washer, then the instrument washer is on the clean side of the sink, because remember, those instruments are going to come out dry out of the instrument washer. So you want to have them right next to the package area. So designing, and then again with the ultrasonic, you've got to plan for that surgical milk rinse. Either you've got to put in an extra tank to be able to put the whole transport rack in to rinse, or put some sort of container in the sink. I'm going to show you a photo of Dr. Boyd's office that I had the privilege to be in last week. And he wanted to do an update during the closure of the pandemic. And he really wanted to put in the new dynamic air removal stack plays. However, they were back ordered. And he knew he was not going to be able to get those in prior to their reopening, like the first week in May. So he did go with the traditional gravity type sterilizers. But to put in the surgical milk rinse, they actually put an extra tank or an extra container in the sink. Fortunately, they had a wide sink, and they were able to put that container in, and he was able to continue to use the same ultrasonic that they had. So he was able to slide out the dry heat sterilizers and slide in 2 new gravity sterilizers with that, and meet the standard of care for wrapped packaged sterile instruments very efficiently before he reopened his office after the pandemic. So lots to consider, meeting that flow of going from dirty to clean to sterile, and sterile storage with it. but that's absolutely a requirement. And that's one of my first considerations when I talk with a doctor is, where is the sink located in the existing sterilization room for a remodel? Because I
Yeah.
can move a lot of other things around, but when you start moving plumbing, it can get very expensive.
Right.
And sometimes in the older office designs, that sink is often right in the middle of the sterilization cabinet, where it shouldn't be there. It should be more to the dirty side.
Okay. Okay.
Yeah.
Well, I think this is some great advice and some real specifics that I think people can carry into their sterilization room and really make some look at it with consideration and make some changes. So thank you so much, Jackie. And can you give
You're
we're
welcome.
going to be back next week with the next step in this series. So can you give our viewers a little bit of a preview of what you're going to talk about next?
That's my favorite part of this process. It's called the go live.
Okay.
We're going to go live with the new sterilization room. So next week, we're going to talk about the training for the staff, training on equipment, training on the use of the cassettes, and the entire process to ensure success for the orthodontic team.
So we will be back next week with the next episode of In the Sterilization Room with Jackie. In the meantime, to catch up on the latest orthodontic industry news or to watch past episodes, please visit our website at orthodonticproductsonline.com. And until next time, take care and stay safe.
Thanks, Allison.
Thanks, Jackie.